Welcome to Medicine Information Factory YouTube channel. Today we shall discuss about Pregabalin. What is Pregabalin? Pregabalin is a prescription medication that belongs to a class of drug known as anticonvulsants or antiepileptics. It works by reducing abnormal electrical activity in the brain and calming overactive nerves, which helps relieve pain and prevent seizures. Uses of Pregabalin: neuropathic pain caused by diabetes, shingles, spinal cord injury, epilepsy used as an add-on treatment for partial seizures, fibromyalgia, a condition causing widespread muscle pain and tenderness, generalized anxiety disorder. In some countries, it is approved for treating anxiety. Common dosage: starting dose usually 75 mg twice daily. Maintenance dose may be increased gradually to 150 to 300 mg twice daily depending on response and tolerance. Maximum dose typically 600 mg per day in divided doses. Common side effects: drowsiness or dizziness, blurred vision, weight gain, swelling in hands or feet, dry mouth, difficulty concentration. Serious side effects: allergic reaction, swelling of face or lips, rash, breathing difficulty, suicidal thoughts or mood changes, muscle pain or weakness, vision problems. Use in pregnancy and lactation. Use in pregnancy: in many guidelines, Pregabalin was classified as category C, meaning animal study has shown adverse effects on the fetus, but there are no adequate and well-controlled studies in pregnant women. Findings from research: some animal studies have shown risks such as birth defects and fetal growth retardation. Human data are limited, but a few studies suggest a possible increased risk of major birth defects, especially if used in early pregnancy. Clinical advice: avoid if possible during pregnancy, particularly in the first trimester. May be used only if the potential benefit outweighs the potential risk, for example, if treating severe neuropathic pain or epilepsy when no safer alternative works. If a woman becomes pregnant while on Pregabalin, she should not stop it suddenly, especially if used for seizures. Instead, discuss a gradual plan with a doctor. Use during lactation. Breast milk transfer: Pregabalin is excreted in small amounts in breast milk. Effect on the infant: limited data suggests that the amount transferred is low and unlikely to cause harm in most infants. However, infants should be monitored for signs of sedation, poor feeding, or unusual sleepiness. Clinical advice: use with caution while breastfeeding. If possible, alternative medications with more established safety may be preferred, especially for newborn or premature infants. What should I do if overdose? Call emergency services or go to the nearest hospital right away. Do not try to make the person vomit unless told by medical professionals. Take the medication pack or bottle with you to the hospital. It helps doctor know how much was taken. If the person is unconscious, seizing or not breathing, start basic life support if you are trained and call for help immediately. Common symptoms of Pregabalin overdose: severe drowsiness or dizziness, confusion, agitation or loss of coordination, double or blurred vision, slurred speech, unresponsiveness or coma, seizures, nausea, vomiting or diarrhea. In extreme cases, it can cause low blood pressure, heart rhythm changes, or respiratory depression, especially if taken with alcohol or sedatives. Treatment in hospital: there is no specific antidote for Pregabalin overdose. Treatment focuses on supportive care, airway, breathing, and circulation. Activated charcoal if seen within 1 hour of ingestion. IV fluids to maintain blood pressure. monitoring heart rate, breathing and kidney function. In severe cases, hemodialysis may be used. Pregabalin is dialysable, meaning it can be removed from the blood by dialysis.